Hi, everyone. My name is Lauren Gonzalez, Chimes' communications manager. And this month, we're focusing on the vital mental health services that Chimes provides across the region. Joining me today for this conversation are Nicole Brown, COO of Chimes Holcomb, and Nicole Barnes, clinical director of Family Focus LLC, which is now a part of the Chimes' family of services. Nicole, thank you so much for chatting with me today.
Thank you for having us.
Absolutely.
Awesome. So first, I'd love to start with Nicole Brown, to kind of see if you can give us a little bit of a history, a quick overview of Chimes Holcomb, kind of starting with Chimes Holcomb's history.
Sure. So Holcomb opened its doors in 1978. We are makes us 48 years old, so we'll be
Wow.
celebrating an anniversary soon. We started by providing life skills support to adults who were discharged from Penhurst Hospital. And then in the years following that, we quickly expanded to mental health and substance use programs. So services included residential, day programming, children and family services, mental health and drug and alcohol counseling, and crisis services. So today we offer programming in central and eastern Pennsylvania, Delaware State, and New Jersey. And we serve children, adults, and families of all ages.
Wow. Thank you so much for that. And then Nicole Barnes, I would love to hear a little bit more about Family Focus's history as well. We're just really thrilled to have you guys as a part of our family. So would love for everybody to kind of really understand, how you guys got to where you are today and then sort of, what services you're offering these days as well.
Thank you. And we are so excited to be a part of Chimes. Like, we're really excited to be with you all. So we started in 2001. We are 25 years old. We're celebrating our 25th anniversary this weekend. We're having a big picnic pool party. So that's going to be lots of fun. When they started Family Focus, they wanted to provide services for family, children, and adults in the community. So their first programs were intensive in-home and mental health skill building. So those were direct community programs. Over the years, we added other programs like outpatient therapy, medication management. We had some other services in the community like parental support, therapeutic mentoring, supervised visitation. So we provide a pretty wide array of services. And that's basically it. That's a synopsis, a short synopsis of our history.
That's wonderful. I hope everybody has fun at the pool party this weekend and that the weather is amazing. Not like last weekend.
Right,
Yes.
right.
I would love to kind of move into, as I mentioned, this is Mental Health Awareness Month, and we'd love to kind of talk about the importance of mental health awareness in our communities, especially the ones that Chime serve, maybe even across the country. So whoever kind of wants to start, and maybe we can just sort of have a conversation on what that looks like for both of your organizations.
I feel like one of the biggest things for Mental Health Awareness Month is helping to address stigma in the community. When we get to the point where talking about a therapy appointment or a medication management appointment or speaking with a counselor about something is as easy as talking about a doctor's appointment with people, because no one minds saying, oh, I have to run to the doctor for this, I have to
Right.
go to the doctor for that. When we get to that point where it's about the same, I feel like we'll be doing much better. Once we reduce that stigma, people will be coming in earlier. We can address things before they happen. People won't roll into crisis as much because we can address those things head on earlier before they spin out of control.
It's great.
Yeah, absolutely. I absolutely agree with that. And I think, you know, maybe to add on a little bit, I think when we can talk so easily about that, or when we reduce stigma, I think it opens up pathways for people to not worry about, oh, it's weird to say I feel a little sad today, or I can't admit
Hmm.
that, or I might be judged or discriminated against, and that then opens up a pathway for people to be educated on how they can access help. Not everybody
Hmm.
knows that.
Right.
They may know, oh, my kid's struggling with anxiety. They're really worrying and they can't make it to school because they're so worried, but they don't know who to call or what to do. And when we reduce stigma, it allows us to have those conversations. And also then opens up, I think, the ability for people to get, to recover,
Hmm.
to get better care, and and resiliency in general, in the
Hmm.
community.
Absolutely. And for people around them to understand, what they're maybe going through and kind of be able to support as well is probably true too. So I
Right.
appreciate both of those, both of your perspective there. And then kind of, this is obviously a challenge that you both just shared, but what do you think are some of the biggest challenges that are facing mental health service providers right now? I'm sure there's many, but if there's a couple that you'd love to speak to just kind of, again, educate some of our folks here at Chimes.
Yeah, we were told 2 to 3 minutes, so
Yes,
we're gonna need longer.
right.
Yeah, exactly.
Nicole, do you want to go first, or?
Sure. Some of the biggest challenges right now are workforce. We want to make sure people who are passionate about working with people with mental health issues are compensated accurately, that they feel that they are, that their work means something, that it's going to make a difference. And right now, with our funding sources, whether it be insurance or private pay or uh, we receive FAP services, which is family assessment and planning teams. We need to make sure that they're keeping up with the pace that we're growing, and making sure that we are able to provide a livable wage and then some to our people. So when we're able to do that, we can provide more mental health services, and we're always needing more mental health services. So as stigma reduces, we'll be providing more services, and as we need more services, we need a bigger workforce.
Yeah, 1,000%. There's certainly a paucity in the amount of providers. Like it's what's the high demand. I'm not an economist, so high demand and just not enough clinicians is the bottom line.
Right.
So massive deficits in psychiatrists, psychologists, our clinicians, and I think it gets worse. I think the more rural you go. So we certainly provide services in lower Delaware State, Southern Delaware, where, just very little resources available. Parts of central Pennsylvania, very little resources, northern Pennsylvania. So it's very hard to recruit and to maintain enough workforce to meet the need. So, and that then burdens the people that we have, because they're trying. Everybody wants to help. We have hearts of gold. That's why we're in the field, and it can lead to burnout for clinicians. And so that's definitely a challenge. I'll also say, I don't know if Nicole mentioned this, but paperwork in general. So the
Yes.
documentation and administrative burden is extreme.
Mhm.
We have over 32 licenses here at Holcomb. I'm sure Nicole has more. We're constantly having to think about and meet regulations that, the bar is constantly higher and higher, but the
Yes.
reimbursement stays the same. So,
Mhm.
so being creative in what we're able to implement and do, so that we're supporting our workforce and our clinicians, so that they can provide, the care that they want to provide, is a challenge.
Thank you so
Oh
much
gosh,
for
I could
sharing
go on
that.
all day, so I'll stop.
Right.
But
No, that's
But
no, it's really, really, really useful information and really good to know what, challenges we're facing as an organization. And then that kind of is a perfect segue, as you mentioned how, we're meeting those needs. How do we think currently, if you'd be able to share again for both Chimes Holcomb and Family Focus, how do you think that we are making the biggest impact in the communities that we support? Even if it's some, good stories or just in general, would love to kind of, again, share that with our organization and see, what you guys have been up to.
I'll jump in, and because I'm sure Nicole has more. So I would say we're building communities kind of one person at a time. If we're helping individuals navigate life challenges, we're better equipping them to handle stress, handle discomfort. The resiliency idea comes in mind again, of just helping them be more resilient and respond
Mhm.
to stress. And ultimately resiliency and recovery are the goals.
Mhm.
So, we see again, we serve all ages. So we see kids come in who have difficulty sitting still in class, and the teachers are ready to kick them out of the class. But
Mhm.
we get in there, we work with the kids, and we help them learn skills to sit still and to function in a classroom, and they graduate, and that not only is impacting the child's life, but it's helping the family too. Um, taking it to adults who we serve, maybe they have depression or bipolar disorder, and they have difficulty functioning, they can't maintain a job. Or, if we're working with them and helping them to develop skills, coping skills, where they can then secure a job and maintain a job, like that's life changing to be able to work and contribute back to society. So it's something I think, being able to see people recover and progress is just really rewarding.
Awesome.
And to piggyback off of Nicole, that is amazing. And I love to see that too, to see the changes that we can make in the community, one person at a time. And that impacts the people around them, that impacts their household. Sometimes we are working with a single person, sometimes we're working with the entire household. But even when we're working with that single person, that individual that's within a household, we're impacting that entire household. And then that goes out to impact the entire community. So like Nicole was saying, we have people who maybe too depressed to go to work, or kids whose behavior get them placed out of school. And we come in and we help bring the skills. We provide a wide array of services from in the office into the community, right? But we know that we can't do everything. We can do a lot of things, but we can't do everything. So we have a very robust referral network. So when we can't do some things, we make sure that we're connecting them to the places where we can, because everything is not within our scope. So we do a lot here at Family Focus and there in Holcomb, but we also refer out to make sure that people's needs are met at whatever level of care that they need to help them function day to day.
Fantastic. That's really fantastic. Well, those are all of my questions for today. It was really awesome to get to talk to both of you. I hope that anybody who watches this within our Chimes family feels a little bit more understanding this month of the challenges that our mental health community is facing and what we're doing to help. So thank you both so much for joining us. And I hope you both have a great weekend, and we appreciate everything that you do.
Yeah.
Thanks. You
Awesome.
too.
Thank
Thank you
you.
for
Thank
having
you.
us.